start with today is discuss the new Invisalign Palatal Expander. My rep sent me this presentation on the new Invisalign Palatal Expander system for children and mixed dentition, or actually even early permanent dentition. And, on first look, people are getting very excited about this and all of that. And to be honest, I'm also excited about it. If we can find an alternative to that Hyrax expander, I'd love that. It's basically this expander, and you can see here as I zoom in, it's this expander that the child wears. Now, you must have attachments on the upper sixes, and it's like a plasticky expander. And you basically have to keep changing this daily to keep pushing your teeth apart and expanding. All right. So these are changed daily, or that depends on the operator. Okay. But generally, they will suggest changing it daily. Each piece of plastic is expanding the intermolar width by 0.25 millimeter. So when you turn a Hyrax screw, actually you're doing 0.5 millimeter a day. So when you do rapid maxillary expansion in children, you're doing almost double of this, okay, per day. And majority of the times you get the expansion in 2 weeks, maximum 3 weeks, but 2 weeks is generally enough to give you a nice big expansion and correct a crossbite. So here they're doing half the amount. So they're doing 0.25 millimeter a day as opposed to 0.5, which is our skeletal maxillary Hyrax expander. And a piece of plastic is being changed daily. So they're called expanders. Now, there's no clean check. You basically just do your scan and upload it. And there are certain criteria. For example, you should have the C, Ds, and Es present, or you should have the 3, 4s, and 5s present. So as long as you have that intact and not exfoliated, you can set them. So already your criteria is a bit limited, okay? Because a lot of kids will have early exfoliation of D or E, and you can't use them. So anyways, so you basically have these many palatal expanders given to you. You tell the technician, hey, I want 5 millimeter expansion, or I want 7, or I want 10, or I want 12, whatever you want. They create the number of aligners that are needed, which is this palatal expander, sorry. And each expander is expanding 0.25 millimeter, okay, according to them. After you finish the active expansion, you scan again, and they send you a number of holders. So the child changes the holders and just sleeps with them at night to hold the expansion. Or you go into your full Invisalign, okay, if they're in permanent dentition. So that is really what the whole thing is about. There's no clean check. You literally scan, okay, and the child's wearing it a bit like that. All right. And it does have a buckle shelf there as well. And you can go into Invisalign after it finishes. All right. So now you understand what this system is. When we do skeletal expansion in children, we need to create a high force system. And I was thinking, oh, wow. So a piece of plastic can expand. My gut said straight away it's dental expansion. Okay. Because biologically, I can't see a piece of plastic creating skeletal expansion. I think it's important that we don't get bamboozled by whatever comes out of a manufacturer, and everybody gets excited. So and you start thinking as if it's going to do wonders. So let's look at this case. Now, that's the only case that I think kind of made me go, oh yeah, it's worth it maybe. And I'll tell you my perspective right at the end. Okay, let's look at this case. You have initial photos of a 10-year-old male, right? And there is a unilateral crossbite. You can see that on that upper left side. You can see there's a huge midline shift. Now, a lot of kids with unilateral posterior crossbite will have a functional shift. It's very common. So there is a huge shift. So the lower midline's a bit off. And you've got your CDs and E's present, CDs and E's present in all arches. Okay, so upper arch, obviously. You see this expander. Okay, one of the key thing of skeletal expansion is what? What is the key indicator of skeletal expansion? I'll give you a hint. You see here? You see here? So can someone put in chat what is the key indicator that skeletal expansion has taken place? Midline diastema. Perfect. The bigger the diastema, that is the amount of That is the amount of sutural split you've had, and that is the amount of skeletal expansion you've achieved. Now, skeletal expansion tends to be a bit more stable in a child, okay, not in an adult, but in a child in the long run. So I'm just gonna, sorry, clear all my drawings, right? So in this case, I was pretty convinced. I look at the first case and I go, this is pretty good. I got a nice skeletal expansion here and overall looking good. You can actually see the palatal vault has changed, the shape has changed. So I start to go, wow, I mean, it's almost impressive and I don't understand how it even happened. So I'm going, right, that's not bad. Okay, we've got a bit of posterior open bite, not bad. Okay, and we've got scans here to look at this as well. And it's looking really good and neat. And you can see here, you can see this attachment here, right? You can see these attachments here. You have to have attachments on some of the teeth. And let's just go back to what is going on here. Sorry, guys, I made a mistake. I'm annotating on the PDF rather than, let's see if it disappears. Yeah, it disappears when I go to the next page. Anyway, so this is really cool, okay? This is really cool and kind of impressive, okay? Then we're getting same. We're still talking about the case report one, and we're still here, and this is cool. And then the orthodontist has finished the case with Invisalign first. Now that's one case that I see, and I go, all right, that's looking cool. Then we're going to case two. Case two is a 7, almost 8-year-old female. Now that's even younger than the first case, right? We've got a unilateral, almost bilateral posterior crossbite. We've got a V-shaped arch. We've got possibly even a habit here. I don't know. We've got a mild transitional open bite. But look at what's happened here. So those of you who are smart, which I know all of you are, what has happened here? Where has the expansion happened? Is it skeletal or dental? Agree? Do you see teeth are still leaning and crossbite? If anything, they push the ease almost near to exfoliation. Agreed. Okay, failure. Okay, so I see one good case and I'm not really convinced with this case. What the? Okay, so we've just tipped the teeth. All right, so they're just showing this cool stuff, right? Don't let manufacturers bamboozle you. You need to see through this. Okay, so I train you to see through this. Let's go case report 3. And I'm going, right, let's look at this. Okay, this is exciting. 8-year-old male, young male, right? A young male, like it's so easy to expand. Now, this male does not even have a crossbite. So we don't even have a crossbite here. Okay, let's look at the expansion we got. Where is the expansion? I'm sorry, I don't see any change here. Okay, I see maybe 0.5 mil, 1 mil change. So I mean, how is this a successful case? How are you highlighting to me that a palatal expander works here? Okay, so I'm seeing maybe some dental expansion, but my Invisalign aligners can do that, can't they? Yeah, does everyone agree my Invisalign aligners can do this dental expansion? I didn't need to do a separate phase of palatal expansion, right? Agreed? Disagreed? Yeah, agree. Okay. Yeah, proclination of upper anteriors look worse. Very good. Picked up. Yeah, right? Got another case report coming, right? So this is another case report. Let's look at initial and after active expansion, okay? Let's look at initial and let's look at the arch form. Now, this case got me really worried, okay? Because we are, let me even just get thicker. We've got this gap here, and that gap kind of is very similar here, maybe 0.5 mil. But look at how much those teeth are pushed. Yeah, so pushed, almost exfoliating out of the arch. That is about to exfoliate, almost early exfoliation, right? For a 7-year-old, we shouldn't be seeing an E exfoliate. Am I right? Am I wrong? Chat, guys, am I right? Am I wrong? Yeah, for a 7-year-old, we shouldn't be seeing E's exfoliate, right? So what we're doing is we're actually creating a bigger problem. We're actually now making this child lose his E's early, right? Which is going to be more difficult in terms of space maintenance. Obviously, I feel that the expansion is not good enough here. Now, maybe it's resolved the crossbite, great. But how did it resolve? By extreme tipping of the teeth. Okay, which movements are likely to recur back, tipping or skeletal expansion? What's more prone to relapse, a skeletal expansion in a child or dental tipping? Perfect. So we've just made this guy very prone to relapse. The more we tip, the more relapse, right? So case report 5. Let's look at this case. Did we get skeletal expansion, guys? If this was changed daily, it's 2 weeks of expansion. Just estimate how much we got. Are you impressed here that you got 1 millimeter of skeletal expansion after 2 weeks? Could you have got this with Invisalign itself? Could you have just given him 10 aligners and got the same result? Look at case report 6. Wow, this is another one of those blown out arches. Just look at the maxilla before and after expansion. So 18 expanders, 8-year-old male, again, 8-year-old male, we could have got so much expansion here. You get these massive diastemas, right? What has happened here? Is this skeletal or dental? Skeletal or dental? Perfect, perfect. Could we have achieved the same expansion with just aligners? And while we were doing aligners, by the way, I would have straightened the teeth as well, right? Could we have achieved this with just aligners alone? Perfect. Very good, guys. You're following me. We're looking at the 6. So only the first case report. Wow, right? And when you see so many case reports and you see one wow, right? It makes you wonder, there's high variability. In fact, the variability is showing me that there's hardly any skeletal expansion. It's more ineffective. It's blowing out arches. It's massively dental tipping. You don't even get this much dental tipping with Hyrax expander. So the reason we turn so fast with a Hyrax, we just go like 0.5 millimeter a day, is to reduce tipping. So by going with a faster pace, we're reducing tipping. So even though here they're kind of trying to go with a fast pace, you're still getting blown out arches, almost like you're kind of worried. Now look at this one too, blown out arch. Did we create any more space than normal growth? You know, his 1-2 was going to erupt, okay? And I'm telling you, this is not at all impressing me at all. And while we're waiting for this expander, you know, I would have just used Invisalign. I would have dragged that 2-2 forward. I would have also created a bit more space for 1-2. I would have also lined up the lower teeth and I would have reduced the overjet. Okay, so 8-year-old, 18 days of expansion, blown out dental expansion. Okay, are you following me? This is the 7th case report. Yeah, very good. So what are you thinking so far? What are you thinking so far? Is this something you want to start using? Is this something you want to start using? Not really? And I mean, why don't I just do Invisalign first or Spark 20 and just get some early treatment, right? If I really want that, isn't it? If I just want dental, why am I going for this new appliance, right? That actually is blowing out arches dentally, creating more instability. And do I really need to do it now? To be honest, this treatment, I don't think it was even needed. You've got plenty of leeway space of Nance here, right? Appliance. Case report 8. Okay, 10-year-old male, case report 8, right? 26 expanders. We got very little expansion, right? We're seeing the maxilla. Dental tipping of the 1626 pushed out, right? And if you push them out like that, of course, you're going to get posterior open bite. What are you going to have to do to close the posterior open bite? Can someone tell me? 1626, what do you have to do now to fix this? Buccal root torque. You do buccal root torque, you create a crossbite again. Okay. So really, we haven't resolved the crossbite actually, or if it was in crossbite, we haven't really. So because we didn't do skeletal expansion, what a shame. Okay. Because these are children that are growing and we're not getting skeletal changes. We're just getting a little bit of palatal vault change. Okay. One thing that is not spoken much in the literature and only very few papers talk about it, it is mentioned, is there something called this dentoalveolus, right? This chunk of bone, right? So expansion is a combination in children of skeletal, which is rupturing that suture. The more it ruptures, the bigger the diastema, the more skeletal the change, the better expansion you've got and more stable. Then you have something called bending of the dental alveolus, which we're seeing here. That's why the palatal vault, right, becomes shallow. So you've got a deep palatal vault, then it becomes a bit broad and shallow because you push the dental bone there, the dental alveolus. Okay, so it's a bit of alveolar bending. And then you have something called tipping of teeth. So you've got that distal tipping of these molars as well. So expansion is a combination of diastema, which is skeletal, dental alveolus bending, and dental tipping. Now, our job in mixed dentition is to minimize the dental tipping and dental alveolus bending because we know that's prone to relapse and we know that that tends to be unstable. Okay, so we really, really want to avoid that. And in children, we have the opportunity of skeletal expansion. And so the final case report. Okay, so we've got CDs and E's. So that's the thing. All these cases have CDs and E's present. So if you have any of them missing, or exfoliating, you can't do it. So you got to do it really early. Okay. So really early when your CDs are present. So this is almost an 8-year-old female. 24 upper expanders means 24 days, maybe 3 weeks, 3.5 weeks. Okay. And this person combined it with Invisalign first in the lower arch. Cool. So they were also doing Invisalign first. Again, this patient never had a crossbite to begin with. Okay. I'm not sure why even palatal expander was used here. What was the benefit of it? What was the rationale for it? Because this same blowing out of arches, can be done with Invisalign. And I don't see what the rationale of skeletal expansion here was. You follow me? Case 1 and case 9, I see skeletal expansion, right? Perfect. Yes. Okay. So out of 9 cases, I see it in 2. Okay. We're seeing this high variability. Many kids, it didn't work. 2 kids, it worked. And in those 2 kids, it can be argued they're relatively mild. They didn't even have massive crossbites or really narrow maxillas to begin with. So I'm a bit hesitant to use it. Now, I do like that it's available. Now, can someone tell me of a clinical indication where I might use it? I'm not going to throw it out. Okay, but I'm not impressed. It's a dental expanding device, and I'd rather go get Invisalign First aligners, right? Or Spark 20 or Spark Advanced, whatever that is. So, or Spark or Invisalign Comprehensive. Like, I'm not going to waste money on additional appliance and time, right? Because while I'm doing the palatal expansion, I can't align the front teeth, right? So, we're wasting time. We're wasting a bit of time here. We're prolonging treatment. Agreed? Disagree? People who don't type in the chat, I'm going to kick them out. No, I'm joking. Agree, disagree. Agree, disagree. Okay. Yes, you can disagree actually. Okay. Now, what I want is you to tell me, where do you think I will use this expander? Because I did think I will use it. And I did think, you know what? I can see some indications here. Okay. Sapna said for better oral hygiene. Yeah, maybe for a high caries risk. Yeah, maybe you don't want to put a banded or bonded hyrax. Yeah, very good for a child who can't tolerate. Yeah, a gag reflex. Although I'm sorry, even this is similar. Okay, so I don't agree that this can't be tolerated because you still have that things coming out on the sides, right? The plastic is stiff, so you could still get a bit of ulceration and rubbing on the side with this one. And you still have the palatal coverage. So I still think speech issue, I don't agree with that. Okay. So, I mean, you've got palatal coverage here. In fact, this could put more lisping. Okay. Compliance is more of a concern. Yeah. Also, parents, if for example, we don't, some patients are not like that. But if you have a parent who's not able to turn the key, just doesn't understand, I guess this is good because you don't have to turn a key. It should really be changed twice a day. Yeah, Liam, it should be changed twice a day. Why not? And I think they haven't tried that. Most of these cases haven't tried that. So perhaps it would work better. I don't know. Maybe even 3 times a day because plastic may have a bit of slop or slap. I don't know. Maybe 3 times a day. It's just been launched. So it on very select people actually used it globally. So here's what I think. I've had a couple of indications where I would use it. And we had one patient who had epilepsy and she needed regular MRIs, and you can't have metal in the mouth with MRIs, right? So you would possibly look at doing this, right? Again, I would rather wait till for a period of 2-3 weeks or a month when they didn't need an MRI, put my Hyrax, right? Do my cranking, get my skeletal expansion, then put them in an Invisalign holder, right? I would rather do that. But anyways, I can think of that. I can think of I can't think of many other reasons other than that.